Imagine waking up one day and your body has no bones. You try to stand, but you just collapse like jelly. Sounds funny, right? But that's exactly what would happen without your skeleton. Today I will tell you a simple story that will help you understand the skeleton, joints and muscles in a way you will never forget as a nursing student. Meet Sammy, the skeleton. Sammy says, "Hello nurse, I'm the framework of your body. I give you shape, support, and protection." Now, Sammy has 206 bones in an adult body. What are the functions of these bones? The first is for support. The supporting bones keep you upright. Next is for protection. They protect vital organs. For example, the skull protects the brain. The rib cage protects the heart and lungs. And they also function for movement by working with your muscles. Sammy also introduces his bone types. There's the long bone, such as the femur, short bones, such as your wrist bones, flat bones like your skull and your ribs, then the irregular bones like your vertebrae. Memory tip: long means length, flat means protection. Sammy has other friends. Let me introduce you to his friends, the joints. Okay? Now, each joint introduces itself. The hinge joint, which is the elbow and the knee, said, "I only move back and forth like a door." Then there's the ball and socket joints at the shoulder and the hip, says, "I can move in all directions." Then there's the pivot joint found in the neck. It says, "I help you say no." Then there is the gliding joint found in the wrist and the ankle. It says, "I allow smooth sliding movements." If joints are damaged, it leads to movement becoming painful or limited. Now comes the real worker, Mia, the muscle. He says, "Bones don't move themselves. I make them move." And explains, muscle pull bones to create movement. They work in pairs. For example, the biceps contracts to bend the arms, the tricep relaxes, then contracts to straighten. This is called antagonistic action. Now, Mia the muscle introduces her types. One is the skeletal muscle for voluntary movement. You control it. Then there's the cardiac muscle, which is found in the heart. Then the smooth muscle found in organs such as the intestine and the uterus. For easy memory, skeleton moves, heart beats, organs work quietly. Now let's bring this into nursing practice. As a nurse, understanding this helps you to lift patients safely and prevent back injury, to care for fractures, and also assist in physiotherapy. Also, it helps you to understand mobility problems. For example, if a patient has a fracture, that is, a bone is broken. If joints are stiff, means movement is limited. If muscles are weak, means the patient cannot move properly. That's why this chapter is very important. Let's summarize quickly. Skeleton is for support and protection. The joints allow movement, and the muscles produce movement. Together, they help the body move and function. If this story helped you understand better, don't forget to like, subscribe, and turn on notifications and comment. I understand chapter 4 next. I'll break down another chapter in a simple story you'll never forget. See you in the next class. Nurse.